very good morning to you. Welcome to Motivation Monday, where we bring you challenging conversations and inspiring stories. Well, today we are talking about oral care. Let me just ask, how is your oral hygiene? In fact, what do you know about oral hygiene? I know there are many questions, how many times you should brush in a day, how you should brush, and all those things. Well, those are some of the things that we will be talking about, so that from today you can actually take care of your oral health. And the person helping us with this conversation is actually a story that just should have a story by itself. He is an inspiring story. He is the vice president of the Kenya Dental Association. He is both a dentist, actually a dental surgeon, and an advocate of the High Court at the same time. Dr. Kahura Mundia is our guest for today and will be helping us with this conversation. And I pray and hope that this conversation and his story will inspire you. So let's get right to it. Welcome, sir.
Thank you so much.
Yeah, it's good to have you here.
Thank you. I'm happy to be here today.
Yeah, just for the sake of our audience, I know I've done a bit of introduction, but just from your own mouth, help us to appreciate who Dr. Kahura Mundia is.
Well, many things I would say. And my name is Dr. Kahura Mundia. I'm trained as a dental surgeon. That's my first training. And I've gone further ahead to specialize as a doctor, and I'm a facial surgeon now. So other than practicing dentistry, there is what we do on the advanced side of science, which is now reconstructing the face, dealing with issues of cancers of the face, and the issues of trauma of the face, anything that is starting from the neck all the way to where the hairline starts.
Yeah.
And again, on the side, I engage in legal matters. I'm a legal counsel, and that's what I do to just balance the different things that I do and serve the society.
Yeah.
So that's my journey. There's a lot we will talk.
Yes,
and
that's true.
I will get.
And you're also the vice president for the Kenya Dental Association.
Yes, I serve as the vice president of the Kenya Dental Association. Now, this is the premier professional society in the country that was established in 1960 to advance on the matters of oral health care. And at the same time, I also serve on the other side, the labor side of doctors' rights, which is the Doctors' Union, KMPDU. I'm also the deputy national chairperson.
Oh, wow.
That's what I do.
Wow, that's quite many cups, as they would say, many hats, rather.
It is service to the profession and service to the country. It's what we need to do as,
all right.
as people.
Now, because I know a bit of your story, and today I wish I could have you for another day for just your story, but today is about oral care. But it would help, I think, someone to just hear a bit, you know, when they hear all these hats that you're wearing, you're a pretty successful man, you know, by all standards. But it didn't begin here. Do you mind just briefly sharing with us where it all started?
Well, the journey started quite a long time back, I would say. Let's say, I don't know where to begin from the time I'm covering my elementary school all the way to high school.
But maybe, I think, elementary school, and it helps us to see how that shaped the kind of man that you are today.
I did grow up in Nairobi, and the challenges that I saw growing up challenged me to want to do something for the people that were around me and the situations that I was that were happening around me. And this was in Korogocho, Nairobi. And having finished 8 years of primary school at one of those slum schools, it really did expose you to a lot of stuff. And you are shaped in a way that you really wish you want to help your people and change their experiences to make them feel better about what should be happening to such kind of places. So I did complete my studies then, and I went to Starehe Boys High School, and I finished my Form 4, and I go to join the university where I studied my first degree, which is now the dental surgery degree. So that gave me proficiency in practicing dental surgery. And I've been doing that for the last 12, 13 years thereabout. And it has been quite interesting. And because that in medicine and dentistry, sometimes you have to advance your journey. And from there is where I decided again, halfway through that 12 years experience, go and study surgery. And in this case, I chose maxillofacial surgery. So it's oral and maxillofacial surgery. So these are specialists who deals with everything that happens from the neck upwards all the way to the face, the hairline. So other than anything happening from the mouth, dental conditions, things happening below the neck, someone maybe stabbing you on the neck, someone hitting you on the neck, gunshots to the face, cancers to the face. All those things need a doctor to attend to. And having seen from where I was that persons were doing all these things of Mira, Mogoka, chewing, and there's a lot of things that happen around that. And those conditions, they affect a lot of young men. And they're not able to understand that those conditions are fixable and avoidable. But before we get to have those cancers coming up for us to manage as doctors, it's best to talk about prevention.
Yeah.
And that's why even the other year, I was very excited to hear that Mombasa County was banning Mogoka because only ourselves as oral surgeons get to see the damages that Mogoka is causing to the young men.
Wow.
So, but those are some of the things that we used to see from where we were.
And some of the things that motivated
you to advance to come and study all the way to the oral surgery.
You know, that's so interesting that you've mentioned that. And I mean, I, for example, know that there are certain effects that things like Mogoka, Mira have. But you're talking even from just an oral healthcare perspective.
Yes.
There are actually issues that are grave. Do you mind just mentioning?
Well, like, you see, Mogoka itself, it does affect the tooth surfaces. So the product is such that it's made of like cellulose-like materials that if you chew for a long time, because of frictional wear, the teeth surfaces, the way they are created, they tend to flatten out over time. So you find like long-time users of Mogoka, they'll have like joint pains. Joint pains because the teeth are misbalanced, because the top surface of the teeth have all been eroded. Now, with that erosion, you also have sensitivity. And exposure to that sensitivity causes more tooth discomfort. And then because they want to use Mogoka with sugar, like chewing gums, that constant exposure to sugar causes poor oral hygiene. And then you start having cavitations on the teeth, you have tooth losses because now the teeth become so unrestorable and they have to be removed. Now, away from that, there are these other additives that they add. Like now they add kuber. These are like the stimulants for the young men and women. Actually, Mogoka is not just chewed by men. Even the women are actually chewing Mogoka. So they put it below the tongue or below the lip, and they chew and they put it on the side just to get that little extra high. So this kind of exposures over like 4 or 5 years, on top of now these other things, this is what no one talks about. They are pesticides. Pesticides that are used by the farmers to spray on these crops. And because you want them to mature faster or to just make the crop have some kind of protection as you're farming it, you harvest it and export it, transport it to Nairobi or these other places. The consumer does not probably know that they need to probably wash up.
No, they don't wash.
Check. So it's just take, and then you buy your kuber, mix it, and start chewing it, add your big G. And over like 4 or 5 years, I have seen all the way from 9-year-olds, either I don't know whether because they are acting in the farm or because they are exposed to this sugar, this material, they start having these issues of ulcerations in the mouth. So you have an ulcer on the lip, you have an ulcer on the gum, you have an ulcer on the tongue. And it's quite disastrous to see a 10-year-old with an ulcer that is not healing, that we diagnose later to become like an oral cancer. And that means in the next 4 or 5 years, the child is gone.
Oh, no.
So oral care is quite important. And it's only that in Kenya, we've not given it the priority that it deserves. But we've been engaging the Ministry of Health to advocate and speak with the Council of Governors to strengthen oral health care. Because most persons do not attend to their matters oral health. So it's not just about brushing daily, brush 2 times a day. So oral care is a lot. It's like the mouth gives you a window to your body. And you have conditions like diabetes, which can be detectable from just looking at the mouth. Or conditions that are happening in the mouth can influence how your diabetes management gets to be, to have a better outcome. So poor diabetes management means poor oral health care. Poor oral health care worsens the situations of diabetes care. So away again from that, you also have oral health care influencing pregnancy outcomes.
Really?
So if you have poor oral health, there's a likelihood of you to have children with low birth weight, because the bacteria that are in the mouth, they have a predisposition to affecting the physiological condition of how the pregnancy state is happening. So there is a lot that happens in the mouth. And that's why we choose, or myself, I choose to study dental surgery. Because there's that exposure, that specificity to at least help these people who are all having all these issues that are going on with themselves. So that's what I do on the side of medical, dentistry, surgery. So now the other things that I do is talking about labor rights. doctors' rights as well, the
Yeah.
employment matters. And for that, again, because of what I've seen in the society, other than just being a help of one type, like now you're a doctor in this noble profession, I decided now to study law.
Okay.
So law was supposed to augment and make sure that Kenyans are able to access healthcare of the best standards. And not just Kenyans as patients, but even doctors are able to sit in that system and provide care to patients in the best way possible,
Yeah.
with their welfare matters being catered for. So that's how I chose to blend now my medical background with my legal training and try and solve them together and advance matters in the society.
Yeah.
So that's how my journey has been.
Wow. You know, when we were talking initially before we began the show, I was amazed at the many things that you do, and I asked, how do you get to do all these things?
Well, sometimes it becomes hectic.
Yeah.
But the good thing with the professions that I chose, you're able to free up your time
Yeah.
and even delegate or work in teams and get to deliver where you're supposed to be.
Yeah.
Because if it is like a dental case that I need to be attending to,
Yeah.
on that particular date, I'll schedule it. And when I'm scheduling it, I'll not plan other agendas happening around that. And once I'm done with that, because most of the work that we do in the other side is advocacy. So like
Yeah.
what you're doing now. So advocacy will be talking about oral health care, talking about doctors' right, talking about patients' right, talking about SHA and how SHA probably is not functioning. So these things, you'll slot the time slots as they happen.
Yeah.
And then now when you've managed to finish your speaking, you now plan your cases.
Yeah.
Now that's when you'll now attend to your cases, book your theaters, book your clinics, book your ward rounds, and attend to your patients. So there's a lot we can do with ourselves.
That's true.
Only thing is to plan how we want to manage our time.
Yeah.
And when you see issues are clashing, delegate. So like sometimes in my legal work, when work becomes too much, I resource out to the persons and associates that I'm working with. And does work seamlessly, and we get
Yeah.
to still assist Kenyans as they should.
So with planning, we can actually
Yes,
do
yes, it
quite
does
a
happen.
bit.
Yes,
Yeah.
yes.
All right. Thank you for that. Now, if we go back just a bit on now the side of oral health care, which is really the conversation that we are having today, what are some of the, I don't know, for lack of a better word, myths you would say that are associated with oral health care? What are things that people believe to be true, and you know, in your study now as a dental surgeon, you realize this is actually predisposing people to other dangers, and they actually embrace these things as being true?
Well, the first myth is that the only treatment to dental issues or oral issues is tooth removal. There is more to dentistry than just tooth removal.
Yeah.
Tooth removal actually reduces the quality of life. You realize that in countries like Japan,
Yeah.
you find 70-year-olds still have like about 28 teeth present in their mouth.
Wow.
They have not lost their teeth. So there are metrics we use to measure in a population setup whether people are having a quality of life that is of acceptable standard. And because you're so well exposed to taking good oral health care, you don't want to lose a tooth. So the journey starts small. You start like with a small cavity.
Yeah.
And the small cavity starts because you're either not taking good care of your teeth by brushing, or you're engaging into habits of eating a lot of sugar. And your teeth over time, teeth are made of a material that's known as enamel. That enamel gets exposed to the acids in the mouth from the sugars that are digested by the bacteria. And these acids dissolve down the tooth and they form a small cavity. You will not realize it at that time, but you'll feel some sensitivity when you're taking something cold or when you're chewing on that particular affected side.
Yeah.
And that's the time your body communicates to you. Please go see a doctor.
Yeah.
Please go see a doctor.
Yeah.
But because our behavior, health-seeking behaviors are not well, we will probably say there's no money, it's not so that serious, we will not rush to go and see a dentist.
Yeah.
And the cavity continues. And as it continues, it goes down into the pulp. Once it gets into the pulp, you start feeling pain. You will still probably not take seriously the matter. And eventually, when it's really, really bad, when you cannot sleep for like 3 nights, you actually don't sleep for 3 nights, even a week. Even some people say they have not been sleeping for a whole month.
Yeah, and they have not even gone to that.
Was one night not enough? So you're like, okay, the moment you feel this, go see a doctor.
Yeah.
Then the doctor will fix the cavity with a dental filling.
Okay.
And it will stop the process of decay.
Yeah.
Now, if you wait until the cavity is quite deep, there is what we call as root canal treatment, which is now to go down the tooth, remove the nerves into the tooth, restore the tooth, and the pain disappears.
Yeah.
And you continue to use your tooth all the way up to 70, or the time that you're going to probably be exiting this world. But all these things, when they're not taken seriously, things can advance and spiral out bigger matters. Now, like what I've said, 1 month with a toothache that has gone down without being managed. Sometimes you can have infections. And that small cavity, it goes down to your neck, starts to become a big swelling. Now you have collections of pus that go into your neck and sometimes trickle down into your chest and cause you breathing complications. Now when you have such kind of a condition, we call it Ludwig's angina. Ludwig is a person who discovered that condition in the 1800s. So you have breathing complications, whereby within 2 hours, if or within that short period, you're not attended to, your tongue closes the airway because there's pus below the tongue, the throat is closed up, and there's pus all over. There's pus in the chest, there's pus in the neck. And you're gone.
Because of
a tooth. Neglect to attend to care urgently as it should. So it is that serious, and these are things that we do as oral surgeons. When you notice it is happening small, attend to see a dentist. And when you wait, when we are not that many surgeons in the face, but when you come to us, the first thing we'll do is to try and decompress. So we'll make a small cut below the neck and release that pus, so that you can now start breathing. So it becomes an ICU case from just a toothache. Now, woe unto you, now you have patients who come to us and they have like 3 or 4 such teeth and they're waiting.
Wow.
But the third bit to talk about is that...
Before even we get to that, because I think you've touched on something that is rather serious, because to be honest, I didn't know that something as small as a tooth could lead to that. But I want us to pause because it's quite a bit to ponder on. Take a small break and then come back and continue that conversation.
That is okay.
Yeah. All right. Please do join us after this. What a conversation we are having. And please do send in your comments, your feedback. 20316 is our SMS line. 0786 316 316 is our WhatsApp line. See you after this.
I want to challenge and encourage all of us, indeed, who are benefiting from the programs that are being aired from this place. These programs are very, very helpful to individuals in our lives, in the families, in whatever we are doing, even in our professions. The programs are varied, the programs are beneficial, and I just want to encourage each one of us, as we benefit from these programs, may we consider the cost of airing these programs. They are very, very useful. My brother, my sister, my son, my daughter, my father, whoever you are, benefiting from these programs, it is costly to air these programs. There are staff who are laboring day and night, 24/7, to bring these programs on air. They are costly. And when we understand that the cost should be borne by somebody else, Paul is teaching the church in Corinth that once they have been fed with spiritual things, then those who are benefiting should also likewise respond by giving back material things, so that there is a balance. So I have benefited personally from the programs that are being aired here, both as a small pastor somewhere back at home, but also as an individual in my growth as a child of God, in my walk with Christ. A lot of these programs have helped me to grow up and mature in my walk with the Lord. They have helped me even as a father and now a grandfather to raise up my children and also my grandchildren. My relationship with my wife, my ministry as a pastor, these are benefiting from the programs I'm receiving from these media house. Therefore, I would want to challenge us all. Let us respond. Let us respond, brethren, so that we can keep Jesus on the airwaves. Hallelujah. Please may you respond. God will bless you because He's faithful. He has promised to do that when we give back to Him what you have also received. God bless you so much. Amen.
To become a partner, SMS the word partner to 20316. That's 20316.
Welcome back. This is Motivation Monday, where we bring you challenging conversations and inspiring stories. My name is Elijah Mukaya, and our guest for today is Dr. Kahura Mundia, the Vice President of Kenya Dental Association. And this conversation is proving to be quite challenging already. I didn't know that just, one single tooth could mean so much. Did you? Well, that is why we have Motivation Monday. And I just want us to get right into this conversation because there is much to glean from this conversation. Welcome back, sir.
Thank you. So where were we?
You had mentioned the myths that
Yes.
are associated with oral health care, and you mentioned just the first one.
Yes.
Yeah.
That aspect of neglect of care that can now spiral out to become an emergency condition that puts you into ICU and an admission. Sometimes that condition can affect your skin.
Yeah.
And you can get admitted for even long course of up to even 6 months, depending on how the circumstances of your body is like. So the other situation is a myth of expectant women should not attend to a dentist or should not be seen by a dentist.
Oh.
Anyone who's suffering a toothache,
Yeah.
in whatever stage of pregnancy, they should see a dentist.
Yeah.
There's no point an expectant person should wait for the 9 months suffering in pain until the last day of delivery, all because they just been told from the persons they had from the communities that you should never go to a dentist when you're expectant. That is very wrong.
Yeah.
If you have a toothache, in the first months of your antenatal clinic, go see a dentist.
Yeah.
Have your mouth assessed so that if there are issues, you're planning on how to have treatments done. And treatments are safe in pregnancy. So there's no point to suffer in pregnancy because that pain can even cause you more issues like a miscarriage.
Yeah.
All because you want to tolerate. And again, taking many medications, especially painkillers during pregnancy, is not advisable and healthy to the unborn child.
That's true.
So we advise for expectant ladies to go see the dentist whenever they have a dental, in whatever stage of the trimester they are in it, so that can be attended to sooner and possible. And the other myth was on the issues of that teeth are usually extracted in the morning. The reason why I had this was because you've suffered a lot over the night.
Yeah.
You don't want to wake up in the morning and become number 20 in the queue.
Yeah.
And because, again, dentists were very few in the older days. Now we're quite a number. We're closing to about 2,000 dentists in the country. You'd want to wake up really early.
Yeah.
And be number 1. 5 a.m., you're on the queue. And that evolved into a myth that dental work, dental extraction is only done very early in the morning. Now, surgery and dental treatments can be done any time of the day.
Yeah.
So when you notice your first symptoms, the sensitivity, the small pain that you're having, attend an appointment, go see a dentist and plan your treatments. And like I said, treatments vary more than just the dental extractions.
Yeah.
There's dental extractions for the teeth that are very unrestorable. Any tooth that is broken down to the point that it's below the gum, it's so rotten, it cannot be saved. That may need to go. Yeah. The wisdom teeth, sometimes most of us, either because of diet changes and cultural habits, we have evolved to have our jaws sometimes not adopting or having the back wisdom teeth fitting in well. Most people in our populations have issues with those teeth. Those ones are usually recommended for removal. Yeah. So don't wait until they have complications with them. Then have them removed by a trained dentist or a specialist that removes such particular teeth. The other treatments are dental fillings. These are for the small cavities to minimize sensitivities and to minimize the progress of that cavitation. The other treatment that we provide is root canal treatments. Cavities that are quite big, advance into the pulp, and now you want to do treatment into the dental roots and the crown surface that is fixed. The other treatment that are existing is to do a crown. So sometimes you can have a tooth that is broken down, not very bad, but again, even if it's broken very bad, you can fabricate a special cover like an artificial cup, a cup that is put on top of the tooth to give it the form and structure, to allow you to continue functioning with that tooth. All this in the spirit of maintaining your chewing integrity. Because if you don't have teeth on one side, you will always be chewing on one side.
On one side, that's true.
And you want to balance and enjoy your food. You cannot enjoy food with the front teeth. And then the front teeth is what we appreciate whenever you are smiling. So if you have no teeth to smile, and it's all about appearances. You find like in some societies, like in the US and the UK, people are very particular about their teeth. They prioritize and make sure these are well done. So I said fillings, crowns, and then the other thing, cleaning. Dental cleaning is advisable at least 2 times a year. The reason why this is done is to minimize gum disease. Because I talked about the tooth. The tooth is a tooth and a root, and then there's a bone around it, and then there's a gum, and then there's a tongue around near the tooth surface. So the gum and in between the teeth, whatever we eat gets stuck in there. And you can do 20 years with all the food that you've eaten all over your life getting stuck in there.
What?
That food that you eat, you brush, yes, but not all of us are 100% best cleaners.
That's true.
So those small, small spaces, food packs in there. And it accumulates. It accumulates, it accumulates, accumulates. Now that over-accumulation of food particles, saliva, causes gum disease. So there's a specialty in dentistry that's known as periodontology. It's a study of gum and gum diseases and how to manage them.
Wow.
So dentistry also has different specialties, but I'll talk about that in a short while. So gum cleaning recommended 2 times a year. So you have a specialist that comes on a machine, clean those debris, that debris that's stuck in between the teeth, so that you can have a good oral hygiene. Because as the gum disease gets affected, the tooth starts to shake. It's like a tree. If the tree roots are affected, the tooth starts to become loose. And eventually you have your teeth coming out or bleeding. So when you have bleeding gums, it's not because the gum is traumatized, but it's because the gum has a lot of blood that is trying to fight the infection around the debris that is stuck between the teeth. Again, that debris causes bad breath. And whenever you have bad breath, it also affects you mentally and psychologically. You start having low self-esteem because you're not able to express yourself. So the mouth is a window to so many things that are happening in your body. And good oral health care ensures that you're able to express yourself confidently without having all these issues that are supposed to affect your well-being. So quality of life is not just in you're not having high blood pressure or you're not having your sugars too high. It's also having a good oral hygiene. And then something else that has been discovered, I think in the last couple of years, mental health has a connection with oral health.
Wow.
And that it has been found that persons with poor oral hygiene are likely to be having mental health conditions. So for you to maintain these 2 types of healthcare, to be in a good state, you need to always go for your oral health checks to ensure that your mental check is well. And again, it's sad to say that because the persons who are mentally handicapped or mentally challenged sometimes, they may not have that motivation to maintain a good oral hygiene. That's why maybe there's that correlation. But it's advisable for all of us in the society to always prioritize oral healthcare matters. So that's what we talk about dentistry. We talk about the specialists, and there are quite a number. Like there are doctors whose work is just to align teeth.
Teeth alignment.
Teeth alignment, make your teeth straight in a perfect curve so that you can smile in the best acceptable way.
And that
so they're called orthodontists.
Okay.
And it's a specialty that takes even up to 4 or 5 years to just train in making teeth to become the perfect setup. Now, when teeth are in a perfect setup, you chew better, you smile better, you have a balance in life. So these doctors are trained in balancing whatever happens in your mouth. And like earlier I had said, there's the other doctor who deals with the gum. He's a periodontologist. And then there's the other person who works with whitening your smile because you want a brighter smile, you want to improve your confidence, or probably have a broken tooth, you want to have a crown, or something that's known as a veneer to make the tooth appear in a better appearance. So these are restorative dentists. Again, they have also specialized, other than just having done the general degree, advanced their studies to make sure that you attend or you get the best of their services. Then you also have dentists who deal with children.
Just
all these things that are happening in adults, they're also happening in children. So you have a child and you've never brushed their teeth from the time they were born. And by the time they're 6 years old, you've exposed them to a lot of sugars, biscuits, chocolates, bottle feeding at night. You're not brushing them. And by the time they're 6, all the teeth are gone. And children with bad teeth, they have poor nutrition because they're in pain, they cannot eat, they are underweight. And all these things, they're managed by that specialist dentist who is a pediatric dentist. So that's another specialization.
By the way, just on that, so what are we supposed to do with our newborns? What do you do with children that are months old?
Newborns, teeth, because they don't have teeth,
Yeah.
you're just supposed to rinse their mouth, either with a clean rag or with a bottle of water to make sure that their mouths are fresh and clean. But once the teeth start to show, start to get a small brush with sometimes in the early stages you may not use toothpaste, but once they start having like about 10 teeth, because by the time you're about 3 years you have now 20 teeth, those are the baby teeth, you can use special toothpaste specially made for the children to brush their teeth. And this because in this age group of 0 to 7 years, they're not competent in brushing. The parent or the guardian or the caregiver is the best person to brush the children's teeth. And you teach them how to brush, demonstrate, do it for them. Brush yourself, demonstrate to them, do each other, then brush. Take those 2-3 minutes, brush their teeth regularly in the morning and in the evening, and then minimize their sugar exposure. Because the sugar exposure, that overnight feeding, because you don't want your child to be crying all over the night, causes more harm than good. And then schedule regular checkups. Regular checkups for everyone, be it children or adults, at least 2 times a year. Just an appointment in January, an appointment in December. It helps you to know what's going on. And probably you may not have money, but because you've scheduled it, you're able to plan. You're told there's a cavity here, the dentist does x-rays, and you're told there's a cavity starting here. It's not very progressive or it's not advanced, but plan for it, come for an appointment, we fix it early so that it doesn't become worse. So there are things that we need to do. And this is something that's supposed to be done at the community level. There are persons who work with us. They're known as community oral health officers. These are persons who are trained to do preventive and promotive oral health care. But they have not been doing their job that well. That's why you find sometimes there's a lot of issues and a lot of dental disease, and the burden is coming up. And there's a study that was done in 2015 that shows that Kenya does suffer a greater burden of oral healthcare diseases. And we need to address this as a country. And we've been trying it. From the union point of view, we have been pushing for dentists to be employed by the county governments, the public hospitals, to go and serve Kenyans, because Kenyans are in great need of these services. And it's sad to say that counties like Mandera, Wajir, Tana River have very few dentists. You have a county of about 1 million people, like Kitui County. About 1.5 million people, they have 3 dentists. 3 dentists for that number of population, with each person having 32 teeth for the adults and 20 teeth for the children, that is a lot of workload. So you need community oral officers to promote and talk about oral health care and good oral hygiene standards. And then the curative aspect, the community persons refer to the doctors and the doctors treat. And like I said, you're about approaching 2,000 dentists in the country. We still need more because our numbers are quite few. More to be trained and to continue offering these services. And dentistry, like it is known, it is trained at University of Nairobi and at the Moi University. And I've had talks about Kenyatta University, Egerton University, Maseno University. They all want to study or start teaching dentistry. It's a course that takes about 4, 5, 6 years. In our time, we trained within 4 years. But right now, it's between 5 and 6 years. And on the 7th year, you get your licensure. And now you're competent and proficient to provide all the things that I'm talking about. And now later on, you can advance, and get your master's and specialize and provide the best attainable standards of healthcare to the Kenyans, because that's what we need.
That's true.
So it's an industry that has somehow not been given the light that it deserves. But we all speak. And because we speak, we use an organ. And that organ is the mouth. And it's very important to all of us.
That's true. That's true. I had cut you short when you were mentioning the other types of specialists. So you talked about the pediatric...
the pediatric dentist, the orthodontist. There's a person also who deals with the older persons. They call a geriatric dentist for the persons who do that. There are also other dentists who deal with teeth replacements. Now probably you've lost your teeth and you still want to maintain that perfect smile, replace them. They're called prosthodontists. So they have done masters up to 4 or 5 years to learn how to just replace the best teeth and balance them and function in your mouth. So these things are not to be taken for granted. They do work. And these persons serve in the society to make sure that everything is in harmony. Then the other specialty that I've not added is now what I'm trained in, the surgical part of dentistry. And outside dentistry, connecting the full body. That's oral and maxillofacial surgery. So when all these conditions happen, and they become so bad, then you cannot intervene with braces. Now, braces are those things that you use for alignment. You cannot intervene with either doing the crown work or doing the fillings. Now you'll call the surgeon. Now the surgeon now will come and check those conditions, like I said earlier. If you have that pus swelling, that's a surgeon now will come in and intervene. If you have those bad wisdom teeth that are fractured in there, that's a surgeon will come in. And then because we are in a violent society, sometimes there is a very high rate of interpersonal violence in the country. And all these things that you hear about gender-based violence. Persons fight. And when persons fight, no one will probably want to hit your knee.
That's true.
People will just want to hit your face. And they don't hit it small. They hit it hard and they break your bones. Now when your bones are broken or your jaw is broken, it's a face surgeon who will come. That's an oral surgeon, oral maxillofacial surgeon. So we'll come to fix and balance your facial bones and make sure that you're balancing and chewing in the perfect way. So that's now the kind of specialty. So there are about 12 specializations thereabout in the field of dentistry. And again, remember, dentistry is a branch by itself, and then there's also this other specialization in medicine. So all these branches communicate together to just assure everyone of the highest standard of
healthcare.
Yes.
Yeah. Wow. Now, I want us to take another break. Because I know one of the questions that come when somebody hears this, and maybe I would desire to see this kind of a specialist, but the issue of cost will come in.
Yes.
So now I want us to take a break, and then when we come back, we talk about the issue of cost, the opportunities available, the opportunities that have been hindered, and we talk a bit about regulation.
Okay, thank you. We'll do that.
Please do join us after this break as we now wrap up this conversation on oral care. I hope from today you'll actually take very good care of your oral hygiene. Join us after this.
Family media has been a blessing to me personally. When I gave my life to Christ in high school, I remember the role that family media played in my personal Christian growth. One of the things that really edified me was the teachings of Pastor Chuck Smith, the late Pastor Chuck Smith. He would go through the Bible and he would go verse by verse, teaching by teaching, and I even later listened to his mentor, his mentee, John Carson. And I remember spending a lot of time when many of my friends used to go for entertainment and watch movies on Saturday nights. As a teenager, I would sit with the radio and listen to Chuck Smith, listen to John Carson, and specifically Chuck Smith from Family Media, and he would teach the Word of God, and I would write notes, and I've got some of those notes even up to today. It really helped me grow. And apart from the preaching of the Word that came through Family Media, the other thing that inspired me was the music. I got to acquire a new taste for music because I was born again. I didn't want to listen to secular music, and the likes of Natalie Grant, the likes of Building 429, Balugal, that music really edified me. And I remember when Family Media would talk about going to Tune In, Yaya Center, and buying this music, and I would save my pocket money. I would put aside money just to go buy an album. And if it wasn't enough, I'd tell my mom, hey mom, I think the CDs we got for, was it $4.99? Was it $5.99? I can't remember. And I would put the money together and I'd go and buy that music. I've got some of those music CDs up to today. My children are gonna see them, and I've got them in a nice CD case, Balogal, Building 429, 10th Avenue North, all those guys, I listen to them diligently. My faith has been inspired through the ministry of Family Media. And I remember during a time when Family Media even had a publication for a very short time. They had it's kind of like a newspaper publication, and they called for people who are interested to come in and to, give their time to distribute these publications. And I remember coming here, still when I was a teenager in high school, and collecting a set of newspapers and standing there on River Road, distributing some of them. I was meant to distribute them at home, but I think I ran out of them. By the time I got home, I just had 2 or 3. And I was passionate to see the gospel reach out to many people because Family Media personally edified me. I hope it edifies you. And if it has, I'm going to ask you, give to Family Media. Take your time, take your money to give to this ministry because the gospel will reach the ends of the earth. And we may not necessarily physically go there, but through ministry like Family Media, the gospel will reach the ends of the earth. Thank you.
To become a partner, SMS the word partner to 20316. That's 20316.
Welcome back. This is Motivation Monday, where we bring you challenging conversations and inspiring stories. And today's conversation is on oral care. Did you know that there is so much to talk about regarding the mouth? I didn't, and now you know. And this conversation alone cannot even exhaust the much that we can talk about these matters. But my prayer And my hope is now that you know, you'll actually take better care of your oral hygiene. Please do that. My name is Elijah Mukaya, your host, and our guest for today is Dr. Kahura Mundia, the Vice President of the Kenya Dental Association. So let's get back to this conversation. Welcome back, sir.
Thank you, thank you.
Yeah, you know, you've mentioned all those things, and somebody somewhere is thinking, yeah, I don't do regular checkups. I mean, to be honest, and this is not a good admission. The last I saw a dentist when I actually went for a tooth removal.
You should do it more regularly.
Now after this I have to. Now I know I cannot argue ignorance now. Now I know. But there are people that perhaps for them there is desire. But they're thinking these things cost. And so they're thinking between putting food on the table and going for that dental checkup, between putting food on the table and dealing with this pain I am feeling, they'll let me itajitengeneza yenyewe. Yeah.
Well, you see, costs are always there in life.
Yeah.
Because even if it's your shoe, it's torn, you'll have to replace it. If it's your rent and it's coming due, you have to pay it.
Yeah.
And if your body is communicating to you, please do something about me.
Yeah.
I'm in pain.
Yeah.
Your body is telling you, take action. But you're telling yourself, the stomach is better. Let's put food in it. So life is about just prioritizing our matters.
Yeah.
And maybe because our behavior-seeking style is what is not really well optimized, then you're able to neglect what is not urgent. And until we are suffering so bad, that's when you show up to hospital. And that's when the costs are too high. Now, dentistry may be expensive when you neglect care.
Okay.
You see, when you brush well, you meet zero costs. When you avoid taking too much sugar, you meet zero costs. When you teach your children how to brush, you meet zero costs. So these persons are comfortable, not suffering like the others. But now when you neglect your oral or self-care, all these things spiral out. And they accumulate. You start with one tooth, becomes two, becomes 3, 4, 5. And each is expensive.
Yeah.
So the more you accumulate problems, the more it becomes costly. So it is advisable to plan your matters well.
Yeah.
Now in Kenya, we have had not many persons with insurance. That's healthcare insurance that provides dental care. And because for a long time, they've always said dentistry is expensive. It's not very expensive, like I said. So it's manageable. And again, because very few Kenyans are employed formally, few have health insurance. And the ones who are informally or self-employed, they normally don't pay health insurance for health insurance. And NHIF previously was even not catering for dental coverage.
Oh, really?
In the super cover, they used to say they'll just do extractions. But even if you're to follow on that, it wasn't optimized in a way that it was supposed to help most Kenyans. But on the other flip side, the civil servants on the NHIF, they did have a good package of dental services coverage. And it is what we've been riding on as advocates in healthcare to have the new system, the social health insurance, that's the SHI and the SHA, to cover for dental care services. And it's unfortunate that as we speak today, they have not onboarded coverage of dental care services.
Really?
It's not on the benefit tariff. And that's sad because Kenyans, ones who are employed and the ones who are remitting self-contributory, they expect those benefits, but they're not listed. And not being listed means you'll pay money out of pocket to see a dentist. So we're pleading with the Ministry of Health, we're pleading with the SHA Authority to revise and review and put a benefits package for the dental care services.
That's true.
Because most Kenyans are being affected in a way that if that coverage was there, maybe to a limit of maybe 20, 30,000 per family household, and you're able to know that as much as affected, my insurance, social health insurance, will cover for something. And in case of anything, I'll top up on the advanced care or any other services that when I exceed my limit. So it's something that we're still discussing about. But the sad bit, for the last, since the launch of the program, that is not happening. And we will continue speaking about the matter because it is quite important and it's what affecting all these Kenyans because when you neglect your care and you have no money and your insurance is not catering for you, that means you're going to spend your other good money to meet that emergency cost. But we hope things get balanced
Yeah.
out in the near future.
Yeah.
So we are quite a number of dentists, and we are readily available to provide this care, be it in private sector or be it in public sector.
Yeah.
Dentists are there, and they are quite a good number to provide these services. So because we all want to be happy.
Yeah.
And a happy mind, a happy mouth, it's a happy body and a healthy state of living,
That's
which is
true.
all you aspire to.
Yeah.
And when you are healthy that much, you make more income for yourself
Yeah.
and for your country and for everyone around you, and the economy thrives.
Yeah.
So all these things are interconnected, in some way.
Yeah. Yeah. And I think maybe then let's touch on another thing, because you said you are a good number of dentists. But there's the reality, even before we get to regulation, and maybe this ties into the regulation, is there's the reality of there are other people masquerading out there as dentists,
Yes.
offering services to the public.
Yes. Now, unfortunately, now in Kenya, because the need is quite there, and in any society, it's like saying there is no society without a madman. There's always be someone out there
Yeah.
trying to make an extra coin because he just wants to exist.
Yeah.
There are quacks in dental services or in dentistry. These people are not trained in dentistry, but they will claim
Yeah.
to have such proficiency to do root canals, to do surgeries, to do braces, to do whitening, and all these things are happening on TikTok, on Instagram, on social media, on their websites.
Oh.
So Kenyans, be on the lookout. There is no point to be scammed, to pay your good money to someone who's just going to play and do funny things in your mouth and cause you more damage and more harm,
Yeah.
which will make you further go and plan to see a dentist to correct whatever bad things had been done to your mouth. Always check whether your dentist is registered and regulated and certified and licensed for the current year
Yeah.
to provide dental services, either as a general dental practitioner or as a specialized dental practitioner in the particular field that you're trained,
Yeah.
the specialists that I mentioned.
Yeah.
And for the quacks out there, the government, the regulator, is supposed to be on the lookout for these persons
Yeah.
and safeguard the interests of the public, because it is not right
Yeah.
for a regulator to sit back and enjoy Kenyans getting defrauded, getting harmed, when all these things need to be
Yeah.
to not even exist.
Yeah.
So the masqueraders, I think it's not a
Yeah.
fair game to have these persons out there in the market.
Yeah.
And they're quite a number, and they're mostly in the rural setups
Yeah.
and in the urban setups, where maybe the compliance regulatory officers may not reach. But you
Like
cannot
the
say they may not reach.
slums.
It doesn't mean that an inspector or a compliance officer cannot reach a slum. Because when someone gets to have a tooth badly removed,
Yeah.
badly removal of a tooth means a fracture to the jaw. So someone has gone into your jaw, and because they're not trained, all the thing to do is they want to work and yank the tooth out, fracture your jaw.
Yeah.
And the tools they're using, they're not well cleaned, not sterilized. They're not trained in the science of how to do this. Then you end up having infections that complicate and get an admission. So from a small point, you rush to just pay that 100 shillings
Yeah.
that complicates and admits you and puts you in bed for at least another 3 months with a fractured jaw or with an abscess because of an infection that could have been avoided. And then someone wants to tell you that I can make your teeth whiter or smile. And they use chemicals. They use hydrochloric acid. They mix with some few herbs, like they smash like sukuma wiki, and they mix it and they say this is herbal remedy. And that chemical, as highly considered as it is, because it has chlorine and it can bleach the teeth, they tell you, pay me 500 shillings per tooth, and your teeth will be super smile, super white. And they coat your teeth with that. Now, that acid corrodes the teeth and burns your gum and burns your lips. And with those ulcers, you start having ulcers that are not healing.
Yeah.
And you start having cancers from the mouth. Because someone is just out to collect your money. Because you want cheap, and because these people have come out and put adverts that we whiten teeth. Actually, we've seen those posters on the
Yeah, teeth whitening.
Teeth whitening. Come. Herbal remedies. There's nothing herbal that can bleach your teeth. It's sulfuric acid, or with hydrochloric acid, with a few herbs concoctions, and someone just purporting with a white coat that I'm a doctor. These are not doctors. These are persons out to harm your health as a Kenyan. Be on the lookout of such and don't tolerate that. And to the regulator, these practices should not happen because it's quite rampant.
Yeah.
Then there's a game of come we align your teeth. If you log in even right now on your TikTok, on Facebook, on Instagram,
Yeah.
you'll see 10,000 shillings, we align your teeth. Now, the field of alignment of teeth, it's a master's training in dentistry.
Yeah. It's not even at the undergraduate level.
It is trained at undergraduate level as an
but
exposure
somebody
for
specializes.
the simple cases, but you advance it as a science and train even further for up to 5 years to become a specialist in that field.
Yeah.
But go to Isili, go to, I think, Rinyaga and some parts in downtown. This practice is rampant because they have realized Kenyans want to look good. And because you want to look good at a very low cost.
Yeah.
Someone has taken an opportunity to capture your greed, to take your money, and to mistreat you and tell you they have treated you now. So you're harming yourself by going to spend your money to those persons who are practicing that.
Wow.
Because now when they do the funny things, it worsens. And your teeth don't balance as they're supposed to. And the wires and the things that they use, they have forces that move teeth. Now imagine all your teeth, 32 of them, they're all moving. Moving means they're shaking.
Where?
Someone moved your teeth because they wanted to align them. You see, when you want to move to align, you move.
Yes.
And there's a force you apply to the tooth. Now that force, imagine your tooth being moved. So you move it too much, it dies. Teeth also die.
Wow.
And the gum gets affected in that movement. Then you have misbalanced jaws, and you have shaky teeth, and it becomes very complicated to manage such kind of conditions. Things that are avoidable by seeing the right trained person.
The professionals.
Yes, the professionals are there.
Yeah.
Don't be lured by an advertisement, 10,000, 5,000, whitening, bleaching, come, because it's a manners out there.
Yeah.
And it's a regulator who's not doing their job by ensuring that Kenyans seek the highest standard of healthcare.
Yeah.
The doctors are there in private practice, the doctors are there in public sector, and they are ready to serve Kenyans. But you should not have Kenyans be subjected to all these backstreet events that are happening. That should not happen.
Wow. Now, as we bring this to a close, now that you've mentioned the matter of the regulator, I think there's the whole question of regulation. There's something recent I saw you'd shared somewhere. Just tell us a bit about that in like 2 minutes.
Okay. Well, like I said, in the practice of dentistry, there are different categories of doctors, and from the specialist, that's a highly trained person in the dental field, and then you have the general dentist. And then you have support staff. Now, support staff are persons who work with the dentist. You may have the X-ray person, the person that does the X-ray. You may have a lab person who takes your models and fabricates the models that you're going to use as a dentist. You could have an assistant, like someone who tells, pass me that, mix for me that. That's called a dental surgery assistant. You could have a dental nurse, someone to receive your patients and sit them and arrange them and just reassure and pacify the situation that happen in the clinic. You can have someone who cleans the teeth for your patients, because as a dentist you want to delegate. You work in a team setup. And then you can have now these health promoters, persons who go out to the community, they talk to patients about oral health care, and then they refer cases to you. And all these persons, they're in a team. And in that staff complement, services are given to the best, highest standard. Because the dentist may not do all these things. Yes, you could, but it's just always good to have as many persons doing jobs in a specialized way to just deliver the best particular observable outcome. Now, what the regulator has done, there is among these support staff, they have chosen to equate them to the level of the dentist. They have no requisite background training. Because you see, dentistry is between 5 years to even 7 years to become that general dental practitioner. And it's so rigorous and it's so intensified that by the time you're coming out there, you are thoroughly well trained. Now, when you have our assistants going out there to masquerade like dentists, and the regulator trying to endorse because they want to collect license fees from them, it is not right. And that's what from the Kenya Dental Association we spoke about, that the regulator, Kenya Medical Practitioners and Dentists Council, is doing a wrong thing by issuing a clinical practice license to persons who are not rigorously trained in the field of dentistry to provide advanced sciences and services to people. You're subjecting Kenyans to harm, and you cannot do that as a regulator. And that's what we're calling out the regulator to stop doing. There are logbooks that are used by persons who are training in dentistry from year 3, 4, 5, that you feel whenever you see a patient. And that your supervisors, your specialists, you're trained by professors and all that. These professors are in the universities. You don't have professors in the colleges and all those. And they assess whether you've met the standard. And when they are sure that you have, you are released to the market. And now you're told, graduate, you're licensed, finish your internship, go see Kenyans, you're a doctor, and be a good doctor all the way until you retire. But not to have persons who've never gone to medical school, dental school, they do not know about this ethos of practice.
Yeah.
It's a science that is quite intimate and quite sensitive. And when you do expose Kenyans to anyone, it's like saying, today I'll give you a license because you have been assisting this doctor. You can do as much as he
surgery.
is.
Yeah.
It's not right. Dentists are trained to observe, assist, and perform procedures. Many, many times. And after doing so many cases, you become better.
Yeah.
And that's when you get to graduate.
Yeah.
You
And
can
you've also learned the theory.
The foundational
Yes.
science must be
Yeah.
there. Now imagine you don't have the foundational science, or you have like 2 hours of it, and the dentist has had like 500 hours of it. So 2 hours exposure and 500 exposure. You really cannot say the 2 hours is equivalent to the first one who's trained for 500 hours.
Wow.
So the regulator is doing a bad job at regulating the practice of dentistry.
Yeah.
And they need to stop that because there's something they put up on their website, like it's known as the scope of practice. That says, you as a dentist, you should do that. You as a specialist should do that. You as an assistant should do that. You as a health promoter should do that. But now when you mix and cause a lot of ambiguity and chaos,
you expose
something
the
is not
public.
right. But this is happening because here there is political interference. Some persons highly connected, they feel like the job market is not ready for their kind of services, and they feel they should apply pressure to the regulator to issue licenses to anybody. Because they need to earn a living. You cannot earn a living harming Kenyans.
That's true.
Just stay in your lane, do the best thing that you've been trained in, work in teams, and provide the highest standards of dentistry to Kenyans.
Wow.
That's all I would pray for from the regulator.
Yeah, wow. Dr. Kahura Mundia, unfortunately, our time is up, and what a conversation this has proven
Plenty to talk
be.
about.
Yeah, there's quite a lot to talk about. It is my hope and prayer that at least we have learned something about our oral care. We didn't know, at least I didn't know.
Yes,
that it was
that's what's happening. And we'll keep on speaking more about it because we want the best for our people,
That's
wherever
true.
we know our advocacy work.
Yeah. So thank you so much. Thank you for the work that you
Mm-hmm.
continue putting in, and even just for the fight that you continue putting it, not just for your profession, but also for Kenyans
Thank you.
at large. Asante
We
sana.
continue doing that.
Yeah.
Asante sana. Thank you for having me here.
Thank you.
Thank you.
Well, we have come to the end of our conversation for today. Oral care has been our conversation, but this looks, like a master's class. You know, those classes that you sit through and it's knowledge after knowledge after knowledge. But all this will be useless if we don't begin from today practicing the things that we have learned. And so please do go ahead and start taking care of your oral health. Well, this is goodbye for today. But before I go, just a reminder that we continue to be able to do this as family media by virtue of partnership with men and women like yourself. And so if you like to partner with us in the work that we do here, feel free to send an SMS with the word partner to 20316. And because we are dependent on the donations of our partners, feel free as well to donate if you have the ability right now through paybill number 316 and for account, just write your phone number. Well, see you on Monday. But until then, take care of your oral health. See you next week.